I'm here in the Netherlands, which has become the home of euthanasia. Astonishingly, around a quarter of all the people who died last year in this beautiful country were killed by doctors. Yes, I'm not talking now about giving pain relief to someone who's dying of cancer. I'm a hospice doctor by my first training, and I know full well that giving good pain relief often actually extends life. But the aim of pain relief and things like that is to provide comfort. It's not a deliberate attempt to shorten life. If you do find that the patient's life is shortened by a day or two as a result of having to use very large doses of drugs, let's say when they have a terminal pneumonia, and anyway they're on their way out, this is not euthanasia. Euthanasia, as I say, is a deliberate act designed to terminate the life of someone who, for some reason, doesn't want to live anymore. Now, this is basically, you could say, assisted suicide by any other name. 25% of all deaths in the Netherlands from euthanasia each year. 25%. Now, most of those actually are through a technique called terminal sedation. What this is, it's giving someone a very large amount of sedatives, which means that they are unconscious, they're not interested in eating or drinking, they're not even capable of eating or drinking, but they are still very much alive, and this is going to be death actually by dehydration, and we don't know how long. It'll depend on the particular patient's condition. This is different from giving a lethal cocktail where you would expect death to take place, let's say, in a couple of hours. One of the common techniques is to give sedation first and then some kind of medication by injection that stops the heart. That is traditional euthanasia. But 25%, this is up in 4 years from 12 or 13%, 25%. What will it be in the next 5 to 10 years? So it means that people choosing to end their own lives and being assisted by doctors to do so, this is becoming the commonest single cause of death in the Netherlands. Could this happen in other countries? Most certainly yes, and the Netherlands may well be at the forefront of a gigantic social change brought about by two factors. One is the increasing length of life expectancy, and two, the increasing length of time that people are spending quite often in a rather decrepit state. You see, if you're a woman or a man in the UK today, the most likely cause of your death will be Alzheimer's. It's not cancer or stroke or heart attack, those kinds of things we have all kinds of solutions for, and those are getting better every year. No, we're talking about Alzheimer's. This is mental decay. This is a very slow illness. This is one which knocks you out gradually, removing your capacity to eat, to have independent thought, to recognize your family, your friends, or even what a teaspoon is for. This is an illness which destroys personality. It creates caricatures of people's former selves. It disinhibits and can create exaggerated behavior patterns. It can create monsters out of the kindest people that were before. This is an illness which robs people of self-respect. In fact, it makes them incapable of experiencing it. This is a very great tragedy. It is it's nothing short of a pandemic across the world, and one of the greatest challenges for pharma to sort out, to try and find research that works, that protects the brain from degeneration. You see, when all the other healthcare systems have been sorted out, when your heart carries on, your kidneys are fine, your immune system is re-engineered, when we've rebuilt the back of your eye using skin cells turned into retinal cells, these technologies are great, but we have to find a solution for the brain. And I believe that a diagnosis of Alzheimer's will be one of the commonest reasons in future why people across Europe will choose to end their lives. I am also certain that euthanasia legislation will become more relaxed right across the European Union and in many other parts of the world. I feel very uneasy about that. I think there are all kinds of implications that society has yet to grapple with. For example, how can you be sure that the person isn't just killing themselves because they feel under pressure, because they feel guilty, because they are worried about the pressures on their family, about the strain on the finances of the National Health Service, whatever it is? How can we be sure that people aren't just killing themselves because they feel sad? They may have a chemical imbalance inside their brains. We know that all kinds of factors affect our mood. And we can prove it because we have many examples, hundreds of thousands of examples of people who feel so extraordinarily sad, overwhelmed by feelings of helplessness and hopelessness that they want to take their own lives. But you put them on medication, the chemical imbalance is dealt with, and they begin to feel more normal again. By the way, depression, is often used as a term. Actually, I think it should only be used to describe unnatural sadness to events. In other words, where the person feels a sadness which is out of all proportion to the actual logical or emotional reasons for feeling sad. Now that's different from, let's say, someone who feels overwhelmed by grief. This is a normal reaction to loss. Grief is a normal part of life, and actually the more you love, the more you will grieve. The greater your affection, the greater will be the gap when the person goes. These kinds of things are not depression. These are parts of the fabric of being human. So what if someone is being terminated because actually their depression has not been fully recognised and treated, and will indeed be temporary? And indeed, if they've been given the right medication, they wouldn't be dreaming of wanting to terminate their lives. What if a family is effectively blackmailing an elderly person whose money they want, and they're putting pressure on them, saying, "Oh yes, it's your time to go, Granny." Wow. What if we have a relative that has gone into a nursing home, and every day there are rooms that get cleared because, and they say, "Oh yes, that nice doctor, he came in and she went on to the other life." What it means is that an elderly person may feel under enormous pressure to follow the same path, to terminate themselves just because it seems the right thing to do. So no wonder, I'm not surprised that euthanasia has become so common in Amsterdam, in Utrecht, in all kinds of towns and cities across the Netherlands. I'm not surprised that there's such a strong call for euthanasia rules to be relaxed in places like the UK. But we do need to watch out what kind of world we end up with as a result. So, what of the future in terms of life expectancy? Well, we're seeing most people in places like the UK are gaining an extra year of life expectancy every 4 years. That's 15 minutes in every hour, and that's been going on for the last 20 years, or 30 years in Japan. Now that's without any tremendous medical innovation. That's just a better diet, more health awareness, a bit more exercise, people aren't smoking, and yes, pharmaceutical drugs, statins and blood pressure tablets and all these kinds of things. But with the genetic revolution, with the ability to predict a disease in the future based on your own gene profile, and a gene profile that we can obtain for maybe $100 in the future instead of $800 million, which it cost in 2001, these kinds of things will radically improve life expectancy again, beyond our imagining, especially when you couple such things with stem cell technology, the ability to regenerate your own worn out tissues. And as these things happen, there'll be questions asked about, what is sensible medicine and what is not. Sometimes I think that medicine has gone stark raving bonkers. When you have people that have been effectively brain dead for, 10 or 20 years, the quality of their expected life is almost zero, and they develop what looks like a terminal chest infection, thank God for that, and then someone jumps in and treats it with yet more antibiotics. For me, this is insane. I'm not saying that we should always strive to keep people alive under all circumstances. Far from it. I think we need a common sense approach, and if we don't, then we just play into the hands of those that will demand euthanasia. Common sense approach, what does that mean? It means, well, you've got someone with severe osteoarthritis whose quality of life is already pretty poor. They've got fairly advanced Alzheimer's anyway. They've got heart failure, they can hardly walk. They're very limited in what they can do. And treating a chest infection every single time. My own feeling is that good medicine in such a circumstance is probably to stop the drugs which are there to prevent a heart attack or a stroke. Indeed, if it was me, I'd throw them away. We need to be sensible. We need to be careful about, jumping on someone's body and breaking 6 of their ribs in an attempt to restart their hearts in a condition where actually it's a merciful release for them to have a heart attack. So we need a much more sensible and pragmatic approach to how medicine is practiced. But we do need to recognise that whatever happens, that the increasing numbers of people in the Netherlands who are effectively taking their own lives with medical help is bound to increase further, and it will become possibly the commonest cause of death in almost all parts of the world.